Hi, everyone. Thank you for being here today. I will be delivering a presentation about stress management and coping strategies, specifically how we can support children and not only children, but ourselves as parents. My goal is for you to walk away and be able to have practical tools that you can use at home or at school and have on hand so that you can help teach kids how to regulate their emotion and how to understand and process their feelings. So I am Dylan DeWitt. I am one of the presenters today. I am a first year grad student in school psychology at Cal State Long Beach. I graduated from UCR 2022 with a bachelor's in psychology, and I have worked as an ABA in school and home settings and am familiar with the coping strategies kids use, good or bad, in environments such as school and home, and how we can exactly fix those bad coping strategies or help maintain those good coping strategies. So I am a part of the CRIS grant, CRIS standing for Culturally Responsive Instruction and Intervention Self-Determination Programs. So it's an OSEP funded grant led by Dr. Kelly Sanderson and Dr. Kristen Powers. It is made up of graduate students at Cal State Long Beach in special education school psychology who work together to develop and implement culturally responsive self-determination interventions for K-12 students with disabilities. So I feel like this sort of coping strategy leads into this self-determination independence intervention because kids with disabilities, especially those on the autism spectrum disorder, have trouble regulating their emotions, processing it, sort of struggle with understanding why they're feeling that way. And learning these coping strategies and help to maintain them can not only help with that, but also help build self-determination, independence as they go on into their adult life. So today's agenda or table of contents is that we'll be first understanding coping strategies, coping and then understanding coping strategy for kids, coping strategy for parents, and other tips that might be useful for you guys as parents. So, what exactly are coping strategies? Coping strategies are skills are used to help the thoughts and behaviors of a person manage stress, trauma, or difficult emotion. Coping strategy are things that we can do in the moment when we are feeling lousy to help us turn down the volume of our emotions and avoid getting overwhelmed. For kids, this can be simple as just taking a deep breath before they do anything, perhaps just asking for help or taking a break. And for us adults, it could be something as simple as just walking outside, maybe just talking things out. And it's to help, these are just tools to help us feel in control rather than overwhelmed. And so, why is it important to regulate emotions? So it helps children understand and manage their feelings. It helps reduce meltdowns, anxiety, and aggression. It improves decision making and problem solving, strengthen relationships with others, and build confidence and independence over time rather than dependency. So, as parents with disabilities may know, it is hard for certain kids or certain students to maintain social peer relationships just because of how hard it is to for them to regulate emotions. A lot of these kids sort of just blow up on seemingly random things, such as maybe one day they were getting teased at and they blew up, or maybe they're too competitive in the game and they don't know how to regulate those emotions, so they start maybe yelling or getting into arguments, and it just sort of just like ruins these relationships they have, and it sort of just makes it so kids don't want to be their friend because they're too emotional or they don't know how to like control those emotions. And sort of goes into why what happens to be the regulating these emotions. You have difficulty focusing and learning. You struggle with relationships and social interactions, what we just talked about. You have high level anxiety, stress, or frustration. You have a risk of long-term emotional or behavioral challenges, and you guys as parents can just feel emotional burnout and stress just because of how hard it is to deal with a kid that's constantly maybe having a tantrum, not knowing how to like regulate emotions. They start crying. And if this happened in public settings, a lot of you guys would just feel maybe embarrassed, maybe overwhelmed, and it's just not good for your mental health because you just start feeling stressed all the time. So learning how to manage these emotions and learning these coping strategies can not only help children maintain peer relationships, but also help you guys maintain your mental health and sort of just be able to not be afraid to take certain kids out in public, maybe just, helping you guys manage your stress levels, helping you guys handle your mental health. And so there's certain developmental considerations to be taken into these coping strategies. Younger children need concrete and simple strategies. So for young kids, they don't need something like, you know, self-talk or just like any sort of self-boost. They just need something simple to do, such as maybe just running around the house, getting that exercise and getting that movement. Just, simply just taking deep breaths, laying down. It's something simple to do and easy to replicate. So that way they could get that basis for things older children can do, such as self-talk, which what we just said, which is just helping prevent that negative spiral some kids go into where they start saying like, "Oh man, today I did so bad. I'm so stupid because I did this today." And you'll notice it a lot when they start saying it around themselves or others, and it just leads to this negative spiral where they just start going on and on. And we want to prevent that because that's a negative coping strategy, which we will talk about later. But you want to replace that with something that allows a more optimistic or positive view, like, oh man, today I did this, but at least, I did turn in my homework, like on the bright side, this happened today, or like, oh, I did so great today because I did this and this and this. You want them to be able to convert those negative feelings into something more positive. And just remember that skills develop over time. So skills like self-regulation and emotional awareness are not skills kids can easily pick up. There's something that they learn over time as they get into more situations where they have these emotional outbursts and learn how to regulate and control them. So they can learn that when these emotions happen or when they're feeling this way, they can start using these coping strategies right away to help prevent escalation and outburst. And so we have three types of coping. So there's problem-focused coping, which is addressing the issue. So this could be, for example, let's say your kid is having a bad day and because they're getting worried about a test coming up next week. So with problem focus, you want to maybe mark down test dates they have, maybe ask teacher when they're taking tests or looking at the syllabus or looking at, just talking to the professors or teachers that when are you having these tests and when you can mark them down and help those kids study for the test, help them be there with them, help them feel more confident about the test so they can reduce that test anxiety. Emotion focus, which is just managing feelings. So maybe, all the kid needs is just a small break. Maybe they just need a little time in another room to help, feel calm again, feel like they're ready to talk it out, feel like they're ready to maybe instead of being angry or being sad, they can just calm themselves down into a nice relaxed state and be ready to maybe approach a solution or maybe just talk about why they feel that way. And the last one I think is important to learn is avoidant coping, which is disengaging or escaping the problem, which we do not want to do because all it does is just push the emotions away and bottle it up, which we do not want to do because not only is it unhealthy for you to do that, but it also escalates the breakout because then when those kids just bottle up those emotions, when they have an outburst, it builds up and the pressure just pops and it just becomes way bigger than it should be. And so we want to avoid that. And we'll be talking more about it in this next slide, which is adaptive versus maladaptive coping. So adaptive, what we just said earlier, where it's solving, you're seeking support, you're relaxing, you're sort of just taking this walk. You're doing this just because it helps you during stressful times and help us feel better in the long term and something that's healthy to do. So you can just simply be taking a walk, maybe just pop some music into your car and just sort of just go off for a nice drive, or maybe you can just simply just talk with a friend. Those are good signs of adaptive coping. Maladaptive coping, however, is strategies that are good temporarily, but aren't helpful in the long term or make it worse. So, for example, maybe an example of maladaptive coping would be the kids just start stress eating. They just want to eat comfort foods. They just want to, like, have like an ice cream when they're feeling sad. And it's good temporarily. It will definitely help them feel like they're calm again. But then they start relying on ice cream and, they just start relying on having food nearby and they start stress eating. And it's not something we want to do because it doesn't promote understanding emotion. It just promotes having a temporary solution to your problems, which is just having ice cream and just forgetting about it. And so common stressors for kids are something like academic pressure. Maybe they have a big test coming up. Peer relationships, maybe they're just having issues with a friend, or maybe they're dealing with some teasing because, it's how do I say this? It's not uncommon for kids to start teasing others just because they provide a big reaction. Not all kids are angels, and sometimes kids are just naturally like prone to just experimenting or like teasing others because it provides a big reaction and sort of entertainment for them, whether malicious or not. And so with these peer relationships, if your kid starts having these big reactions, it becomes a lot easier for kids to start targeting them for maybe teasing. And it certainly will stress out your kids enough to do that. So you want to learn these emotional regulation skills to prevent these escalation or these type of behaviors from being encouraged because they won't have a reaction out of them and they'll simply just leave them alone after a while. And transition traumas, of course, where like maybe they're moving to a new school and they don't know anybody, so they start feeling alone, or maybe they go into a new class and they start worrying about if their friends are in the class or if they can make new friends, if they'll be alone. And so for something as small as this, it could be huge for kids. So talking about coping strategies for behavioral, for younger children, simple strategies and physical strategies work the best. Examples include deep breathing, taking a break, movement, exercise, stretching, using a calm down space, like maybe going to their room, maybe just going into like a corner, like a calm down corner where they can just run around, maybe, hit like a toy or like hold a toy so that way they can just be able to process those emotions. And for older kids, you can use cognitive or emotional strategies, so identifying emotions and mindfulness techniques. So you can use stuff like talking about their feelings, helping define the problem, like, oh, today, I tried making a friend, but they rejected me. So you want to be able to, oh, so you're just having like issues making friends? How about we go out and go to this club that I know for a hobby you like, and maybe you can see me help make friends there. So we talked about positive self-talk earlier, where you just want to talk about how even though this happened, you did this today, so that makes you feel good. And establishing routine to help them feel like they're constant. So like always having something to do for them so that they can just, while they're doing that thing, they can help process those emotions and help them feel more calm. But an important thing to note is that every kid is different. While certain coping strategies for some kids may work, some kids might prefer others, and some kids just don't work well with certain coping strategies. Like, for example, routine. Some kids, if their routine breaks, they start actually feeling more stressed and more anxiety ridden, which you don't want to do. And so it might not work for them, but some kids need that routine to help them feel like they're okay, help them feel like they can just process their emotions while they're doing something. Like during homework, they can help process their emotion while they're doing it. It just helps that routine works for some kids, it doesn't work for others. And don't worry if you're not succeeding at first finding that coping strategy. There's so many of them, and it's every kid is different once again. So trying to find that one is going to be a long process, but it's going to be well worth it once you learn it. And try multiple strategies, see what fits best for your kids. Don't try to rely on just one, but try relying on multiple because eventually there will be some sort of desensitization where they like maybe stop relying on it. So using multiple strategies can help kids feel fresh, help them remind them they have multiple skills on hand and they can use them for any type of situation they're in. And so I want to talk about coping strategies for parents because you guys play a huge role in this. So, what's it called? Parents learn by or kids learn by watching you. So when you stay calm and you model calm behavior and you talk things out, you have these routines, you offer solutions and you show solutions to the kids, they will learn how to do it from you. And not only that, but when you regulate your emotions and you regulate your stress, you not only um what's it called? Care for your own mental health, you are able to better support your child when you do so. You and if you don't do it, you could lead to emotional burnout. Which is important because, a lot of times parents feel stressed and they don't know what to do. And so when you learn to regulate your own emotions, you can help others before you can help yourself before you can help others. And an increase in parental stress can increase child behavior problems. And kids are smart, and no matter what age, they will recognize hypocrisy. They'll recognize, why are you doing that? Why do I have to do that and you're not? Or why are you doing that but I can't? They will recognize hypocrisy. So being consistent with not only your kids but yourself would also improve yourself in the long term. And so we will talk about family school collaboration because it's important to communicate any struggles or goals during meetings with IEP teams or with any teachers because we also want to know what's effective for your kid and what's not effective for your kid and learn what your kid needs in terms of support when they're running into problems. And so we can help communicate preferred coping strategies or help communicate new ones that they can use if it's not working anymore or if it's school environments that's not really successful in, like having a place to calm down, because then, they'll be missing out on teaching time. So maybe they'll communicate like, oh, we learned today that your kid has a new coping strategy where they can just hold like a doll or something and they'll just calm down. And so sharing these goals and behaviors with not only teachers but other parents can help you feel less alone and less um, isolated in your struggles with dealing with emotion regulation and outbursts. And so we're talking about maintaining coping strategies because the best way to teach coping strategies is to maintain them and keep them coming. You want to practice during non-stress time. So even if you think they're like fine today or they're doing great today, remember to take deep breaths when they're, feeling too happy and they feeling too bad, just take a deep breath, calm them down. Remember, like, hey, thanks for being excited, kiddo, but let's just, take some deep breaths and then you can tell me more about it. Or, build into daily routines. So when they wake up, you can like have them start taking deep breaths, help them start moving around. Maybe when you're at home, you can just take a walk to the park nearby and you want to monitor and adjust strategies when you feel fit. So you want to just keep a mental note of like, oh, today this didn't work. Maybe we need to try something new, or maybe instead of, taking a walk right after school, we can wait a bit, help them calm down at home, and then we can take a walk. And you want to reinforce the use over time. So you want to encourage them using it every single day, or not every single day, but you want to encourage them to use it when they can. So that way they can build it on their own. And it always helps to have a visual reminder of like a chart, of a doll, of a toy they can use to help them remember that the coping strategies are at hand and what they can do. So like if, they're having trouble, processing sadness or anger and they start like huffing and puffing and they start balling their fists, you can just, show them like deep breaths. You can and it just helped them have that visual reminder or like point to a chart saying like remember to take deep breaths, and it'll just help the kid remember, and like they will just have them in the back of their mind that they can always just take a deep breath when they're feeling sad or angry. An important thing to note though is to avoid over reliance on coping strategies. Too much of anything is a bad thing, and it could lead to issues processing emotions and avoiding rather than confronting. So if your kid relies on coping strategies too much, it can actually be a bad thing. Which is weird to say, but like if your child is constantly having to take a deep breaths when situations occur, or they need to always go somewhere or like take a step outside when they have trouble processing emotions, it could actually lead to um, difficulties facing the issues head on rather than trying to process, understand why they're feeling that way or understand what this feeling is. And so, of course, there are alternatives to coping strategies. Be aware of triggers. For a lot of kids, the trigger is no. When you say no to something like that, they'll, like, can I have a snack today? And you say no because we ran out of things. Hearing that word no can instantly just start triggering that escalating outburst. So you want to just reframe the problem or response. So maybe instead of saying no, you say something like, hey, we don't actually have any snacks today. How about we go to the store and go get some later? Or, you know, maybe you can't play any games today, but maybe over the weekend you can have extra time if you do your homework right today. You want to offer alternatives rather than just say no because to kids, no is the ultimate end all be all. If you say no and don't offer any of the solutions, they'll just start seeing like they can get that thing or they won't get that thing and they just start bawling and they start crying. So you really want to be able to learn how to reframe responses to avoid those triggers. When as we said earlier, when faced with a problem, offer solutions or alternatives to avoid triggers. You want to prevent the outburst from happening in the first place. So that's why we want to offer those triggers and we want to avoid those triggers and we want to offer solutions. And that's all. Thank you so much.